You might think that diligently using the bathroom right before your head hits the pillow is the smartest thing you can do for a peaceful night. But after age 60, that could be the very reason you're wide awake at 2 a.m., making that frustrating trip to the bathroom yet again. It seems like the most logical habit in the world, right? It's what we've all been told to do since we were kids. Go try one more time just in case. Our parents meant well, and for most of our lives, it was sound advice. It's the responsible thing to do. But the truth is, for many seniors, this just-in-case trip does nothing to address the root causes of why your body is producing urine overnight. And worse, it can contribute to a cycle of anxiety and hypersensitivity in your bladder, making the problem even more pronounced. The real issues are happening hours before you even think about sleep. In this video, I'm going to pull back the curtain on the 5 hidden mistakes that are actually forcing you to wake up. These aren't the generic tips you've heard 1,000 times. We're going deep into the science of your body. And the number one strategy we'll discuss doesn't just help you sleep through the night, it also helps improve your digestion and reduces inflammation while you rest. So stay with me until the very end, because the solution to your sleep problem is likely not what you think, and the difference could genuinely begin tonight. And before we dive in, if you're ready to finally reclaim your uninterrupted sleep, please do me a small favor and smash that like button right now. It truly helps our vital health message reach more wonderful people just like you who need to hear it. Also, be sure to subscribe to the channel so you never miss out on our weekly health tips, and drop a comment below telling us what country you're watching from. I absolutely love connecting with our global health family. So, the problem isn't just about that last-minute trip to the bathroom. It's about creating the right conditions in your body for a full 8 hours of peace. Let's break down the 5 most powerful strategies to stop waking up at night. We'll start with the most foundational and build up to the most impactful one at the end. Let's start with pillar number 5, your hydration timetable, the 3-hour liquid curtain. This is the most well-known tip, but it's also the most misunderstood. The common advice is, don't drink before bed. That's too simple and often leads to dehydration. The real secret isn't about not drinking, it's about creating a hard cutoff. The rule is this: draw a line in the sand 3 hours before your intended bedtime. After this point, your liquid intake should cease entirely or be limited to tiny sips if absolutely necessary for taking medication. The science behind this is all about giving your body, specifically your kidneys, enough time to do their job. When you drink a glass of water, it doesn't just sit in your stomach. It's absorbed into your bloodstream, raising your blood volume. Your kidneys then filter this excess fluid from your blood to produce urine, which is then sent to your bladder. This entire process, from drinking to your bladder reaching its "I'm getting full" signal, takes roughly 90 minutes to 3 hours, depending on your age, kidney health, and what you drank. As we age, our kidney function becomes less efficient. The filtration rate can slow down, meaning it takes longer to process the same amount of fluid. So, if your bedtime is 10 p.m., your final glass of water or cup of tea should be finished no later than 7 p.m. This gives your system the full 3-hour window to process that liquid, fill the bladder, and for you to empty it completely before you get into bed. And this isn't just a theory. A comprehensive review on nocturia, the clinical term for waking up to urinate, published in the Journal of Urology, consistently points to evening fluid restriction as a primary behavioral intervention. Studies show that patients who adopt a strict 2 to 3 hour pre-bed fluid cutoff see a significant reduction in the number of nightly awakenings. It's one of the most effective first-line defenses. So here's the actionable plan. First, determine your bedtime. Let's say it's 10:30 p.m. Your liquid cutoff time is 7:30 p.m. Set an alarm on your phone for 7:30 p.m. labeled liquid curtain down. Second, don't try to camel up and drink a huge amount of water right before the cutoff. taper your hydration throughout the day. Your goal should be to consume most of your daily water intake by the late afternoon. This keeps you hydrated without overloading your system at night. And third, if you must take medication, use the absolute smallest sip of water possible to get the pill down. We're talking less than an ounce of water. Now I have a question for you all. What's your current pre-bed drinking habit? Are you a last-minute water drinker? Share your routine in the comments below. Let's talk about it. All right, on to pillar number 4, the pre-sleep voiding protocol, your double empty technique. This builds directly on our last point and addresses that just-in-case P we talked about. Simply going to the bathroom once before bed isn't always enough, especially for men dealing with an enlarged prostate or women with pelvic floor changes. Your bladder might not be emptying completely on the first try. This is where the double voiding technique becomes a game changer. It's a method frequently recommended by urologists to ensure maximum bladder emptiness. Here's how it works. Go to the bathroom as you normally would about 30 minutes before you plan to get into bed. Don't rush. Sit down, relax your pelvic muscles, and let your bladder empty naturally. Once you're finished, don't just get up and leave. Stand up, walk around for a moment, or simply wait for about 30 to 60 seconds. Then sit back down and try to urinate again. You might be surprised that you're able to release a little more urine. This residual urine, if left in the bladder, is what can cause you to wake up just a couple of hours into your sleep cycle. The science behind this relates to the mechanics of the bladder and the surrounding muscles. The bladder is a muscular sac, and for it to empty completely, the detrusor muscle needs to contract effectively while the sphincter muscles relax. As we age, or due to conditions like benign prostatic hyperplasia, BPH in men, this coordination can be less effective. The first urination empties the bulk, but a small amount can be left behind. The brief pause and change in position allows the bladder to resettle and any remaining urine to drain to the bottom, making it easier to expel on the second attempt. A 2017 study in the International Journal of Urology highlighted that double voiding can significantly reduce post-void residual volume, which is a key contributor to nocturia. Participants who adopted this technique showed a marked improvement in sleep continuity. So the how-to is simple but requires mindfulness. 30 minutes before bed, perform your first void. Stay on the toilet for an extra 30 seconds to ensure you're relaxed. Then get up, maybe brush your teeth or get your pajamas ready. Right before you climb into bed, go back and do the second void. This simple two-step process can make a world of difference. Let me ask you, have you ever heard of the double voiding technique before? Is this new information for you? Let me know in the comments. Now for pillar number 3, the sunset dining method, your diuretic food awareness. This is a massive one that most people completely overlook. What you eat for dinner and when you eat it has a direct impact on how much urine you produce overnight. Many common and seemingly healthy dinner foods are actually natural diuretics, meaning they make your body produce more urine. Combining these foods with a late dinner is a recipe for a sleepless night. The primary culprits are foods high in potassium, acid, or even hidden sugars and salt. For instance, a large salad for dinner seems healthy, but tomatoes, cucumbers, and celery are all known natural diuretics. That spicy curry, chili peppers can irritate the bladder lining, increasing the urge to go. Even a simple dessert like a bowl of fruit salad can be problematic. Fruits like watermelon, cantaloupe, and citrus fruits have very high water and potassium content. And let's not forget about salt. A salty meal like a frozen pizza or Chinese takeout makes you thirsty. You drink more water, and the salt itself makes your kidneys work overtime to flush it out, pulling more water from your body to create urine. The timing is just as crucial as the content. Eating a large meal late at night, say after 8 p.m., means your digestive system and your urinary system are working at full capacity right when your body is supposed to be shutting down for rest. Digestion itself requires water, and the byproducts of metabolizing food need to be filtered by the kidneys. A study published in the Urology journal found a direct correlation between late, heavy dinners and the incidence of nocturia. The researchers theorized that the metabolic load placed on the body late at night disrupts the natural circadian rhythm of kidney function. So here is your sunset dining plan. First, aim to eat your last major meal of the day at least 4 hours before bed. If your bedtime is 10 p.m., dinner should be wrapped up by 6 p.m. This is even more important than the liquid cutoff. Second, be mindful of your dinner composition. Opt for bladder-friendly foods. Think lean proteins like chicken or fish, complex carbohydrates like sweet potatoes or brown rice, and non-diuretic vegetables like carrots, peas, and broccoli. Keep the salt to a minimum. Use herbs and spices like rosemary or thyme for flavor instead of excess salt or bladder-irritating chili powder. And if you need a snack after dinner, make it a small protein-based one like a handful of almonds, not a bowl of fruit or ice cream. Do you have a go-to late-night snack? After hearing this, will you reconsider it? I'd be fascinated to read your thoughts below. Okay, let's move to pillar number 2. The sleep cocoon, your room temperature and clothing. This might sound completely unrelated to your bladder, but it's deeply connected. Your sleeping environment, specifically the temperature of your room and the clothes you wear, can directly trigger your body to produce more urine. This phenomenon is called cold diuresis. Here's the science. When your body gets cold, it initiates a process of vasoconstriction, especially in your extremities, your hands and feet. This is a survival mechanism designed to shunt blood away from the skin's surface and toward your core to keep your vital organs warm. This shunting of blood increases the pressure in your central arteries and veins. Your body, specifically your kidneys, senses this increase in central blood volume and misinterprets it as fluid overload. The response? The kidneys kick into gear to filter out what they perceive as excess fluid to lower the blood pressure, and they do this by producing more urine. So if you're sleeping in a room that's too cold or you're wearing inadequate clothing, you are essentially tricking your body into making you have to pee. The proof for this is well established in environmental medicine. A study from the American Journal of Physiology demonstrated that even a mild drop in core body temperature during sleep can lead to a significant increase in nocturnal urine production. The ideal room temperature for sleep is generally recommended to be between 60 and 67 degrees Fahrenheit, or about 15 to 19 degrees Celsius. However, for seniors who may have poorer circulation, the lower end of that range might be too cold. You might need to aim for a slightly warmer 68 or 69 degrees. The how-to here is about creating a stable, warm thermal environment. First, check your thermostat. Experiment within that 65 to 69 degree range to find what feels comfortable without being cold. Use a programmable thermostat to keep it stable throughout the night. Second, pay close attention to your feet. Cold feet are a primary trigger for vasoconstriction. Always sleep with socks on if your feet tend to get cold. Wool socks are excellent as they keep you warm even if your feet sweat a little. Third, evaluate your sleepwear and bedding. Use natural breathable fabrics like cotton, bamboo, or wool. These materials are excellent at regulating body temperature, keeping you warm without causing overheating and sweating, which can also disrupt sleep. Avoid synthetic fabrics like polyester, which don't breathe well. The goal is to be comfortably warm from head to toe all night long. What temperature do you keep your bedroom at night? And are you a socks in bed person? Let's take a poll in the comments. And now, for our number one most powerful and overlooked strategy. This is the one that ties everything together. Pillar number 1, the body alignment method, your sleep position and pillow placement. This is the ultimate secret weapon against waking up at night. Your sleeping posture can either compress your bladder and surrounding organs, creating a false sense of urgency, or it can create space and tranquility within your abdomen. The worst position for nocturia is sleeping flat on your back, also known as the supine position, especially without proper support. When you lie on your back, the full weight of your abdominal organs can press down on your bladder. This constant gentle pressure can send signals to your brain that the bladder is fuller than it actually is, triggering the urge to urinate. Furthermore, sleeping on your back can worsen conditions like snoring and sleep apnea. Sleep apnea is a major and often undiagnosed cause of nocturia. When you stop breathing during an apneic event, the oxygen levels in your blood drop and carbon dioxide rises. This stresses the heart, causing it to stretch. In response to this stretching, the heart releases a hormone called atrial natriuretic peptide, or ANP. This hormone's primary job is to tell the kidneys to excrete sodium and water, in other words, to make you pee. The best position is sleeping on your side. Specifically, sleeping on your left side can be most beneficial. This position takes pressure off the bladder and can even improve circulation. But just sleeping on your side isn't enough. You need to do it correctly. This is where pillow placement becomes critical. The key is to place a firm pillow between your knees. This simple act keeps your top leg from sliding forward and twisting your spine and hips. It aligns your pelvis and hips, which reduces strain on your lower back and crucially prevents any undue pressure on your bladder and urethra. For your head, you want a pillow that is thick enough to keep your head and neck aligned with your spine. If your head is too low or too high, it can kink your airway and contribute to snoring or apnea. There is a wealth of research on this. A study in the Journal of Sleep Research directly linked sleep apnea to severe nocturia and found that treating the apnea with a CPAP machine or positional therapy dramatically reduced nightly urination. Positional therapy often involves simply encouraging side sleeping. The anatomical logic is undeniable. Aligning the body reduces physical pressure and physiological stress, both of which are major drivers of nocturia. So, here is your body alignment plan. First, make a conscious effort to fall asleep on your left side. If you tend to roll onto your back, you can try special positional pillows or even the old trick of sewing a tennis ball onto the back of your pajama shirt. Second, get a dedicated knee pillow. It should be firm enough to keep your knees separated by a few inches. This will feel strange at first, but it will become incredibly comfortable. Third, check your head pillow. When you're lying on your side, your nose should be in line with the center of your chest. If your head is tilting down or up, your pillow is the wrong size. Investing in proper pillow support is investing in uninterrupted sleep. Now, I know what you might be thinking, but I've tried some of these things, and what if I still have to get up to pee? That's a valid concern. So let's quickly address the 5 golden rules to follow, even when you're doing everything else right. Don't worry, here are 5 simple rules to stack the odds in your favor. Number 1, volume. If you absolutely must sip something after your 3-hour curtain, we are talking about 1 ounce of water, no more than a small shot glass worth. Number 2, timing. We've established this. 3 hours before bed is your hard cutoff for any significant liquid. No exceptions. Number 3, temperature. Avoid ice-cold drinks in the evening. They can be a shock to the system. Room temperature or warm is always better. Number 4, no just-in-case trips. Once you've done your double void and you're in bed, stay in bed. Don't get up again just in case. Trust the process. Getting up and down can create anxiety and wake you up more fully. Number 5, relax. When you do your pre-sleep voiding, don't rush. Stress and tension can prevent your bladder from emptying completely. Take a few deep breaths. Let it happen naturally. So my friends, today we talked about more than just a few tips. We talked about a holistic system for reclaiming the deep, restorative sleep that you truly and absolutely deserve. We discussed how to time your hydration, how to properly empty your bladder, how to eat for a calm night, how to create the perfect sleep environment, and how to align your body to remove pressure and stress. I'm not asking you to change your entire life overnight. That's overwhelming. Just pick the one pillar, the one idea that resonated with you the most. Maybe it's the sunset dining, or maybe it's finally getting a pillow for your knees. Pick that one thing and try it tonight. Just try it for 3 consecutive nights and observe how you feel. Which one will you try first? Let me know your choice in the comments. I want to hear your plan. And if this video gave you a sense of clarity and hope, do me a favor and just type the word hope in the comments. And of course, if you haven't already, subscribe to the channel and turn on the notifications so we can continue this health journey together. Take care, may your nights be quiet, long, and deeply restful, and may your mornings be bright. I'll see you in the next video.